Hi, I'm Dr. Mike Milligan. I'm here with Kris Powell from Silverstaff Clinical Laboratories, Director of Marketing and Education. Kris, thank you so much for being with us.
No, thank you. I really, really appreciate it, Dr. Milligan. We're happy to be here.
Great. So we're going to talk about once you purchase your kit from Silverstaff and it arrives at the office, what do you do now? So
Well,
what do you do now?
I'm happy to explain it.
Okay.
First of all, you're not necessarily purchasing the kits from Silverstaff.
Okay.
We provide you with everything at no upfront costs.
Right.
And the only time that we charge your office is when we provide a result for your patient.
Okay. Even better.
Yes, even better.
Okay.
I take my job, I love what I do. I learn something new every day and I take it very seriously. And as marketing director, I am educating both the dental office as well as providing material to educate the patient.
Okay.
So it's twofold.
Right. Let's educate the dental office first.
That's right. I usually send trial kits. I think it's important to have everyone familiar doing some demos in office.
Okay.
I set up an online training, which is very extensive.
Okay.
It goes through everything on successful collecting, storing, shipping.
Right.
I go over in detail a lot of the clinical significance because this is new to a lot of practices.
Oh, absolutely. It's brand new.
And I think it's important from the training to make sure hygienists know, why are these important? Why should we be doing this?
Right.
Because 9 times out of 10, they're going to be the salesperson. They're going to be one speaking to the patient.
They are in my office.
And I try to provide as much help for them with chairside notes.
Okay.
And the beauty of what I do, I try to cater to the clinic. Everybody's set up different, have different protocols. If what I provide in the initial kit is not enough, or it's too much, or it needs to be tweaked, a simple phone call, because I understand everybody's different and one size does not fit all. But at present, I provide information that will start a conversation. So from the time the patient walks in.
The mail, and you're providing online training.
That's correct.
Okay, for both front desk and the clinical staff.
That's correct.
Okay. Let's roll through just a little bit of that.
One aspect, the first part of the training is introducing the clinic to our web portal.
Right.
It's an extremely intuitive, very user-friendly lab information management system. We can simply email the URL link to the office manager or whoever is going to be in charge of doing the ordering, and that's how we also result back to the practice.
Right.
So that's a very important part of the training, and I'm able to release my keyboard and turn it over, and they can actually do some demo testing to make sure they're comfortable with it.
Okay.
And then we really dive into the collection, successful collection methods.
Okay, collection of the sample.
Of the specimen,
Right.
that's correct.
Right, not of the money. Collection of the sample, okay.
But we also
let's
provide
talk-
information on collection of money as well.
I know you do, because you provide it to us. So let's talk about back in the operatory, the treatment room. How do we discuss this with the patient?
I think with new patients especially, and you know, existing patients, there can be a form they fill out, part of their patient history. And I think we've identified 4 important questions to ask. Are you diabetic? Do you smoke? Do you have a history of cardiovascular disease or a history of periodontal disease?
Okay.
And I think if you check yes to any of those, you are most definitely a candidate. And I think by having that material available in the waiting area, it gets them thinking, and our goal is to have them start the conversation with the hygienist.
But if they don't,
then
the hygienist certainly can.
Absolutely, and they've got the verbiage they need, the scripts they need, that if the patient does start that conversation, they're equipped.
Right.
And we try to make it very visual. Not just a bunch of words on paper. We try to show a graph.
Excellent handouts that you have there.
Thank you.
Laminated handouts.
Yes.
Very simple, intuitive information. Excellent for both for the staff to discuss with the patient.
That's right. And we provide anything that we discuss on the online training is pushed to them. They have the full presentation. In your kit of supplies, we have a staff poster, which is basically pictures, very good visuals of this is what the blood looks like dropping on the card. This is how the card looks. So it's a cheat sheet, if you will.
Right, exactly. So what else would you like to tell us about the communication? You give us all these aids. Is there anything right now you'd like to discuss with us, or once we get set up with you?
Well, at any time, if anybody needs any reference material, and we have copies of just about every article on oral systemic health, clinical significance. You know, I'm happy to provide the office with whatever they need. I'll research whatever they want me to research, and I try to keep the website up to date. We like to consider that a good tool as well for reference. But you know, any PowerPoints I'm able to tweak for an office, I can do it.
Okay, so we're going to do a little demo on the in a few minutes on the finger stick. Okay, we can probably find a subject, probably this finger right here. But for now, let's say, okay, we've taken the finger stick, and so we've got this sample here. What are we going to do with it now?
The beauty of the blood spot card, which you'll see, you do not have to treat it as whole blood. That meaning keep it cool like milk. So that would mean the dentist office having a cooler to store it, keep it cold. You have to ship it that day. With the dry blood spot card, you know, in 30 minutes time, the blood is dry. And it can be placed in its desiccant bag, and that's it. It's very simple.
Desiccant bag,
and then yes. From that point, it goes into a UPS envelope, and it gets overnighted. If you see that you're going to test a patient a day and don't want to have to hassle with doing a daily shipment, the dry blood spot card in the dessicant bag stays good for up to a month. So there's options. If you forget,
you wouldn't want to wait more than 2 or 3 days, but I wouldn't think. But
yeah, and you know, we propose maybe one shipment a week, but we certainly provide you, if it's easier to just be in a routine of doing it every day, we're happy to provide that as well.
So we ship it off to you then, okay?
You
get it, and then you get us back the results.
That's correct, and that's through the web portal.
Okay.
If it's overnighted, we could usually have 2 of the 3 tests same day. We always say within 5 days, but it's quick.
Yeah,
it's very quick. And if you don't mind, I'll go back when we send a kit. You're ready to test patients and you've been trained. Then you get a master kit, and it's a box with 15 patient kits. So we try to make it a compact box, very simple. Grab one bag for the patient. Everything you need's in that bag. Then after 10, you've got a reorder slip. So you know you're down to your last 5. We just try to keep it very, very simple. Our goal,
we need that in my office. I need that.
I need that in my office. The goal is at the end of training, it's okay, now what? How are you going to identify your patients? What can we do to help you identify your patients? Let's attempt to do these 15 in a 2-week time, because I think once you do 15, it starts to become a habit. Then it you know, quite possibly you've identified 3 people that are at risk, and that's a sales tool all in itself. To start stating percentages to your patients that we've tested 15, and out of that 3 were at risk. And we also provide the information to refer out to cardio groups. So,
well, fantastic. So, so Kris, so now we get the results back. What do you give us in that, and what do we do with it?
Well, first of all, the results come directly to you, and you have a location number. Only your location can see your results. Whoever has access can pull it up, and they can print it. It's in a PDF form. You can save it. After you review it and print it, it's always in the web portal. What we've done with our result sheet is if you test quarterly, you're going to be able to graph the outcomes.
So if we test a patient quarterly, then we can actually see the graph.
The patient will be able to see not only their current results, but how they've changed and hopefully improved. But they'll be able to track their progress.
We'll know.
Yes, and we think that's very important.
Yeah, it's very important.
And it's usually a couple days turnaround, and your staff can pull up the report.
Super, and then we'll know the results of our therapy. We'll know if we need continued therapy or maintenance, if we need an additional referral, or where to go from there.
Absolutely.
Okay.
Absolutely.
Super. Anything else you'd like to tell us before we close and go do the demo? No,
I'm very excited to introduce this dry blood spot card. it's going to be a good fit, and I think it'll work well with the hygienist.
Absolutely.
The ease of use, and I'd love to show everyone a demonstration.
We're going to go do that right now. Kris, thanks so much
Thank
for being
you.
with us.
I appreciate it.
Okay.
So Dr. Milligan, I have a HeartSmart screen kit opened up for everyone to see. Typically in the hygienist area, you have a sink. It's preferable to have the patient wash their hands under the warmest water possible or provide them with a warm towel. But there's another option since we're not by a sink. I'm going to open up these supplies, and if I can ask you to the old-fashioned way, let's create some friction and get some warmth with your fingertips down. While you're doing that for a few seconds, I'm going to open up my supplies. Of course, hygienists are used to having their gloves on, and it's very important to keep your gloves on. There you go. Thank you. I think that's good. I'm going to take the alcohol prep. It's good to go on either side of the pad of either the ring finger or the middle finger. Clean it with the alcohol prep. I'm going to let it air dry for just a second. Now the hand can be, you can hold it or you can have the patient lay it flat. I'm going to twist off the top of the lancet. The best way to create an opening is you're going to go against the grain of the fingerprint. So I'm going to hold the lancet against the grain, press till you hear a click. This initial blood drop, I'm going to wipe with a gauze. It's got fibrinogen in it. It's going to want to clot, so I'm going to get rid of that. We're going to allow the drops to freely hit the card. Everyone bleeds a little differently. If you have trouble, you can milk the finger down the sides of the finger. You can see that was 4 drops. So while he's holding that, and as a hygienist, I can see immediately where the specimen needs to hit in order to get enough blood to run the test. So the blood has hit the 2 markers indicated. So we've stopped the bleeding. As you can see, the blood is migrating across the serum separator card. This is the serum being pulled away from the whole blood. What you do is you let that dry for 30 minutes. Ideally, you would do this test before any other procedure or cleaning, because this will dry and then it can be placed in the desiccant bag and it's ready to be shipped. So I'd like to watch this progression a little bit, and I'll get you a Band-Aid. Now, was that uncomfortable at all,
No,
or tell me about that?
Nothing. It was easy.
Okay.
No problem.
Okay. Now, this lancet is not considered sharp. I know you have sharps containers in the facility, but just FYI, they're not. The needle retracts back in, so you can dispose of all this in biohazard trash. Now, this was a demo purpose. If you were an actual patient, there's some protocols that we have. These are all barcoded, and they're unique patient identifiers. So, Dr. Milligan, if you were a patient, right. Each kit is barcoded. It's a unique patient identifier. We also ask the hygienist to write the name and date of birth on the card. Then when they order electronically, they enter the barcode. We want to make sure we're getting the specimen for the right person.
Absolutely.
And it's very simple. We do time collected, date collected, name, date of birth, and gender. And that's what we need on our end to perform the test.
Well, just from my perspective, that was simple. And I mean, you hardly even felt it.
Right.
It was just so easy to do.
Yep.
And yet, wow, can we really impact the patient's health through this?
And that's why we provide trial kits, because I'm comfortable with it. I've done it several times. If you have the tools to play around with it and practice, you just get better and more comfortable, and it just makes it a better experience.
Yeah, and so one of the tricks is the grain of the finger comes around the finger this way, and you want to go not with the grain.
Correct.
You want to go across.
Going across
the grain
creates a little bit bigger opening.
Right,
Yes, sir.
right.
Yes.
And it won't close as much, and it'll bleed easier for
Absolutely.
you. Okay.
Yeah.
What else about this should we tell you? What's this? What else you want to
That is the desiccant bag. This is what the card goes into after the 30 minutes drying time. It keeps the specimen safe for up to 30 days. Great. So we will have a drying rack and a system where you can keep this together.
Right.
And it can be shipped as is. Doesn't have to be kept cold.
So we let this sit here for 30 minutes?
Yes, sir.
And then it's ready to go in the bag.
That's it.
Can sit for, send them either every day or once a week?
That's correct.
Easy enough.
It is very easy. It is
Anything
very
else?
easy. No, sir, you were a very
That's it.
good patient.
Oh, well, thank you.